The reason that I chose a combination of clinical work and research work was part of the mounting frustration I was feeling as a clinician, in that I felt that there were better ways to prevent diseases. There are probably better ways to engage patients with how they interact with their healthcare services, better ways to diagnose, and the realisation that the way in which we're doing things could be better. I'm sure that's a lot of doctors and anyone who works in healthcare, I'm sure, thinks those things every day, but I found them so frustrating that I kind of felt I need to at least work alongside my clinical work in trying to answer some of these questions. I'm interested in how we can prevent stroke after something called TIA, or transient ischemic attack. And these are, if you like, suddenly occurring funny turns that get better, and after they happen, patients are effectively back to where they were before. They don't last very long, and so people may not always necessarily perceive them as being something that puts them at risk of having something more serious happen to them. And I was interested in trying to work out why there is a delay in people coming to see us and letting us know. This is something that I would often see in practice. People saying, "Oh, I had this funny turn happen some time ago," and they would describe something that would sound very worrying. And I'd be interested. Well, I'm interested in trying to work out how we can get people who are at high risk seen earlier and quicker. And it dawned on me that actually the way in which we organise healthcare may be contributing to that delay. We have to recognise that systems have to change. The traditional model of seeing a doctor either based in the community or in hospital effectively creates two bits of care, and most people's care are sort of in the middle, really. They may not need to lie down in a hospital bed, but they need more than office hours, office-based general practice can offer them. And that's why I'm really excited about this project that I'm working on in Abingdon. I work on there clinically, and also looking at how to evaluate it as well, perhaps from a more research perspective. It's a bit like a one-stop shop, but we can offer ongoing care as well. And we see patients referred by GPs who traditionally would send to hospital. Instead, they come and see us. They get seen by either an experienced GP or a geriatrician, elderly care specialist, as well as expert nursing care, physiotherapy, occupational therapy, and dedicated social workers as well. And they get a real kind of rounded, holistic assessment of sort of medical, social, and wider sort of care needs. And we position ourselves sort of deliberately in between traditional general practice and traditional hospital, and we're trying to sort of offer care that's right for that patient at that time, rather than trying to squeeze them into one particular model or another. The majority of patients are, for start, stunned that this service actually exists, and always, the first time they come onto it, they are agog that actually you can have care in this way that's much more rational, and allows them to sort of have some of the sort of home comforts, but also more medical support than they get from traditional general practice. The relatives, by and large, are very, very supportive, because they see that their elderly mother or father or aunt or uncle is actually getting a very sort of patient-centred service. A lot of what goes on in this department, in this building, is around testing the kind of questions that will drive and deliver healthcare change in the future, and this project really is the embodiment of that in many ways. And because of the work that we're planning to do to evaluate it, we'll be able to demonstrate what those new models of healthcare should be, and I guess more crucially, what's the gain, what's the cost as well, because it's one thing to show that something works, but actually to make policy change and to enact change on a wider level, you've got to show what the benefits are and measure those accurately, and also what the costs are, and measure those accurately too. Without those two things, then policymakers aren't going to change or do anything or act on your research.